Hello, my name is Michael, and today I'm going to talk about the roles of a nurse in various settings, such as an agency or registry, occupational nursing, correctional facility nursing, mental health nursing, and lastly, travel nursing. I will also talk about the pros and cons of working in each setting and the responsibilities that each nurses have in these settings. The first setting I would like to talk about is agency or registry nursing. In order to first know the role of an agency nurse, we must understand what an agency nurse is. Agency nurses provide healthcare in a wide variety of settings rather than staying in a dedicated facility. The role of an agency nurse will make a visit to the patient, whether it be at home or at a facility, which can include nursing homes or rehab centers. Due to agency nurses working close to doctors and other providers, this role requires a high level of knowledge. Some of the responsibilities that agency nurses have include traveling to the patient's location, assessing the patient's health, administering care and medications, maintaining patient records, and training nursing staff. When assessing a patient's health, they conduct interviews prior to treatment and administer tests to help determine their overall health. Just like any other nurse, an agency nurse is responsible for administration of medications and caring for the patient. Agency nurses can travel to the patient's home or long-term care facilities in order to provide routine care. Agency nurses have the responsibility to maintain the patient's records regarding their symptoms, health issues, treatments, etc. This is then reported to the provider to help support care and activities that are to be done for this patient. Lastly, agency nurses also have the responsibility of supervising and teaching nurses who are less experienced. Experienced agency nurses also have the option of bringing along less experienced nurses with them to different job sites to provide hands-on instructions. Working for a nursing agency has its pros and cons. Some of the pros that are included with working for an agency include having a more flexible schedule, less stress, the opportunity to focus more on the patient, the ability to help other nurses, and adaptability. When working for a nursing agency, you have the opportunity to choose when and where you wish to work. This is because nursing agencies contract with a variety of facilities and have shifts to be filled at any time depending on the size of the agency. With this, many nurses are able to balance their home life and work life. Working for an agency also reduces stress that may come with working for a dedicated facility. By working as a per diem nurse, you are able to remain in a neutral position. If you have a bad experience with a certain facility, then you have the option to not go back to that facility. Working for an agency gives you the opportunity to actually focus more on your patient rather than just having to do other tasks or supervising other nurses. Lastly is adaptability. With this, you are able to adjust to new locations and demographics quickly. You learn to communicate, connect, and care for clients in a timely manner without difficulty. Now, moving on to the cons of working for an agency. Some of the cons or disadvantages include no guaranteed paychecks, less predictability, feeling like an outsider at different job sites, and experiencing more first days. The downside to working for a nursing agency is that if you don't work, you don't get paid. You don't work for salary while working per diem, so that means no paid time off. When partnered with an agency, shifts can also be less predictable or guaranteed. You might also feel like an outsider at different job sites. Other nurses might be unaware of your skill set, and doctors may tend to go to familiar nurses rather than going to a new face. Since working for an agency requires you to be at a different facilities and job sites, you might experience more of those first day jitters more than you would like. Each new shift would consist of a new introduction, going through the facility's protocols, learning what your supplies are, and experiencing the working habits of the facility. The next setting is occupational nursing. Occupational health nursing is a specialty practice that provides and delivers both health and safety programs and services to workers, community groups, and the working population. This type of practice focuses primarily on restoration and promotion of one's health, prevention of illness and injury, and protect from work-related injury or hazards. Occupational health nurses, or OHNS for short, have a knowledge combination of both health and business that they use along with healthcare expertise to provide a both safe and healthful workplace. Some of the responsibilities the occupational nurses have are case management, counseling and crisis intervention, health promotion and risk reduction, legal and regulatory compliance, worker and workplace hazard detection. OHNs routinely coordinate and manage the care of workers that are ill and injured. OHNs counsel for issues such as substance abuse, work-related concerns, psychosocial needs, wellness or health promotions, etc. Occupational health nurses also help design programs that promote and support lifestyle changes in order to reduce risk and injury. Strategies such as immunizations, nutrition education, stress management, exercise education, early detection of diseases, monitoring, etc. are all used to help keep the working community healthy. Occupational health nurses recognize and identify hazards, then they monitor, evaluate, and analyze the hazards in order to develop a preventive plan to reduce the risk of work-related accidents. Now that I have discussed the roles and responsibilities of an occupational health nurse, I will now go over the pros and cons of being an occupational health nurse. Some of the pros that are included are having an increased awareness and safe working culture, increase in productivity, correct training and use of tools, and new opportunities. A healthy staff is a productive staff. When occupational health nurses do their job correctly, the staff should feel protected and have a sense of loyalty to their job. They know that the OHNs are looking after them while they are working and won't have to put their health at risk. When OHNs correctly educate their staff about proper use of tools, the staff will know how to use these needed tools and machinery, therefore lowering the risk of injury. Some of the disadvantages that may come with occupational health nursing include increased risk of injury and death, legal repercussions, decrease in productivity, and an increase in turnover and a loss of reputation. The failure to install adequate health and safety procedures can result in injury or fatality for the workers. A work-related injury may not only put the client out of commission, but it may also impact the quality of life and can also cause harm to the business's reputation, productivity, and financial status. Failure to recognize the importance of health and safety can result in decreased productivity and an increase in staff turnover. Up next is correctional facility nursing. Correctional facility nurses help provide direct care to individuals that are in correctional facilities such as jails or prisons. These types of nurses need various experiences in the care setting because they may treat individuals for emergency conditions, chronic or acute illnesses. Correctional facility nurses help ensure safety within the inmate population while also providing medical care as needed. Some of the responsibilities that correctional facility nurses have are intake exams, medication administration, inpatient care, chronic care, and mental health care. Individuals who are incarcerated initially undergo physical assessment to help determine what their needs will be while they are in there. Individuals with chronic conditions may need their daily medications, which is then distributed by the nurses to help ensure adherence to the medication regimen. Individuals who require monitoring are those with chronic illnesses such as hypertension, asthma, etc. Individuals may also need special treatment if they experience an acute injury or a serious illness. Lastly, inmates may need attention if they have conditions such as schizophrenia or bipolar disorder and experience trauma within the facility. Some of the advantages that may come with correctional facility nursing is a strict focus on patient care, autonomous practice, variety, and rewarding accomplishments. As correctional facility nurses have stated, the difference between correctional and non-correctional nursing is the emotional limitations that take place between the nurse that's providing care and the client that is receiving the care. Correctional facility nurses are encouraged to avoid forming a relationship with the inmates. This kind of approach allows the nurse to focus solely on the patient's condition at hand and the treatment options. Conversations must also be kept to a limit while being a correctional facility nurse to avoid biases and personal opinions that can affect the care of the client. Correctional facility nurses serve as the gatekeeper to other medical services due to the ability to utilize their full range of their clinical skills. Doing so keeps the inmates safe and healthy. Nurses can typically find themselves following a certain structure or routine, while correctional facility nurses have the opportunity to manage more variables throughout the day. Nurses that are looking for ways to gain a variety of experience have the opportunity to do so while working as a correctional facility nurse. Lastly, correctional nurses are there for all of the patient's healthcare journey. In traditional nursing, the patient will move on to a specialist or have a primary care physician, while in a correctional facility, the nurses are there to see it all. One of the main disadvantages that I was able to find for correctional nursing was employee burnout. Correctional fatigue is defined as the cumulative negative change over time of corrections professionals' personality, health, and functioning. This can be a result from the inability to cope with the situations presented or the lack of resources that is needed to be working in a correctional facility. Additional disadvantages also include organizational stress, traumatic stress, and operational stress. Organizational stress is related to the relationship between people and the workplace. Traumatic stress is related to the presence of violence, injury, or death. And operational stress is related to the lack of equipment or staff needed to do a job well done. Mental health nurses work in various settings, ranging from hospitals to patients' homes. Mental health nurses are responsible for providing support and caring for patients who have mental illnesses. Mental health nurses also support people with a variety of issues such as anxiety, bipolar depression, personality, and eating disorders. Mental health nurses must also provide care for these clients without showing any judgment towards them due to their disability. Some of the responsibilities that are included with mental health nursing are organizing workloads, assessing and planning nursing care, patient visits, administering medications, and writing and updating patient records. Of course, these are only a few to name, and there are many more responsibilities that mental health nurses have. I will now discuss some of the advantages and disadvantages of mental health nursing. Some of the advantages is the ability to help others. You have security of your current job and a variety of opportunities within mental health nursing. When it comes to mental health nursing, patience is definitely a virtue. These nurses care for all sorts of people who suffer from mental or emotional distress. These individuals require someone who understands their situation. Mental health nurses care for these people with personal struggles and see them eventually heal, which can be rewarding. The jobs of mental health nurses is basically secured due to a shortage of mental health workers. The plus side of working in mental health is a variety of job opportunities. You can either choose to work in a nursing home, a drug and rehab center, or in the hospital setting. Some of the disadvantages for mental health nursing is burnout or emotional distress, lack of gratitude, and risk of danger. Mental health nurses are faced with different kinds of emotional stress, which can increase the risk of burnout and emotional stress. There is also the chance of becoming emotionally attached to the patient and becoming invested in their recovery due to your care. Mental health nurses might not get a thank you that they deserve from their patients. Mental health care workers are there for the most difficult times of that individual's life. When the patient moves on, these nurses are unsure of how well their hard work paid off when caring for these patients. Lastly, mental health nursing can be dangerous. Depending on the situation, the patient may be aggressive and violent, and these nurses have to understand that they may experience some physical confrontations with these patients. The last setting is travel nursing. A travel nurse is a nurse with various clinical backgrounds who work for an independent staffing agency. These nurses are assigned to different areas that are in need of staff for a certain period of time. While travel nurses work for independent staffing agencies, they still have the same responsibilities of a traditional nurse, such as administering care, administering medications, communicating with the provider, creating a plan of care, and assessing the patient's condition. Some of the benefits that may come with travel nursing is the higher pay, the opportunity for advancement in your career, the opportunity to travel, and the ability to help understaffed facilities. Travel nursing provides the opportunity to advance due to a variety of settings that is available. Through travel nursing, you will be able to broaden your experience because each facility has their own procedures, processes, equipment, etc. Being a travel nurse gives you the opportunity to go around and explore different locations and get to experience life in the area that you are sent to. Some of the disadvantages that may come with travel nursing is feeling homesick, wear and tear on your vehicle, being away from friends and family, etc. The feeling of homesick is normal for a travel nurse. You move to another location for work that can typically last around 3 months. However, there is an option that allows you to bring family along to where you are sent to. The agency may reimburse you for travel expenses. However, this does not change the fact that you have to use your own vehicle to travel. You can either choose to use a rental or your own vehicle, but either way it's going to be expensive. Lastly, friends and family are our support groups. A travel nurse may find themselves needing that support that they might not get due to traveling and being away from their friends and family. That is all for my presentation, and thank you very much for listening in.